Dottie-Kay Bowersox, and I'm the Public Health Administrator with the City of Racine. I'm here today with Mayor Mason. We have some frequently asked questions that we're going to answer for you today. Mayor?
Dottie-Kay, thanks so much for everything you and the public health staff are doing here in the City of Racine. We're getting a few questions that are coming up again and again, and I'm just hoping you can help clarify them for people. The question we're getting the most is, why is it important for people to stay at home?
During this pandemic, staying at home as much as possible and limiting your exposure to others is one very important way that everyone can contribute to the solution. This is part of what's known as social distancing, or most recently, physical distancing. COVID-19 is very easily spread from person to person and can even be passed along before someone shows symptoms of the infection. Staying home and not visiting friends and family can help to protect both you, your family, and others from contracting and spreading COVID-19. This is especially important for protecting the most vulnerable parts of our population, including older individuals and people who have pre-existing health conditions. Even if you're not part of a high-risk group, chances are you have a loved one or a friend who is. So please stay home unless it's absolutely essential. Please stay home.
Dottie-Kay, what is isolation and what is quarantine?
While they are often used interchangeably, isolation and quarantine actually have distinct meanings in terms of how public health authorities use them. Isolation is the process of separating sick people with a contagious disease like COVID-19 from others who are not sick and restricting them from leaving their home or other location where they have been placed. This prevents them, the individuals, from spreading disease. Quarantine is what is used when an individual has been or may have been exposed to a contagious disease. It restricts their movement and exposure to others while waiting to see if they develop the disease.
Can you explain to us again, how does COVID-19 spread?
Oh, thank you, Mayor. The virus that causes COVID-19 is believed to mainly spread from person to person among people who are in close contact with another person through respiratory droplets that are made when an infected person coughs or sneezes. And again, coughs or sneezes. These droplets can stay in the air for several hours, either being inhaled by others or landing on surfaces. If they land on a surface that an individual touches, and then that person touches their eyes, their nose, or their mouth without washing or sanitizing their hands, they may become infected. And that is why we are asking everyone to please wash your hands for no less than 20 seconds using soap and water and drying them off, and or using hand sanitizer when the soap and water are not available.
So as people are beginning to take precautions, how do we best prepare to quarantine our families at home?
Oh, thank you, Mayor. Preparing for emergencies is important. It is recommended that you limit trips out of your home to the essentials, such as shopping for groceries or picking up other important items like your prescriptions. If possible, only have one member of the household make a trip to the store or the pharmacy. This is important for maintaining social or the physical distancing of 6 feet. Also, don't hoard groceries and other supplies. Only purchase what is necessary for your family, again, for 7 to 8 days. Retailers are working very hard to keep their shelves stocked, so everyone should do their part in only purchasing what they need. This means that others who are also in need of the same supplies for their daily lives have a chance to purchase those items as well. So please, again, 7 to 10 days, one person at the store, and only for the essentials.
Thanks so much, Dottie-Kay. We'll visit again soon with more questions from our constituents.
Thank you.